Human blood. Project Basic Learning PBL.
Theme Transportation. Content Standard. Human blood. Learning Standard. Investigate the importance and management of donated blood.
Group members.
Hi, my name is Li Jiaying. My class number is number 12. I am the group leader and these are my group members.
My name is Chongjae Chi. My class number is 5.
My name is Lim Chong.
Hi, my name is Lai Mei Lam and my class number is 41.
Contents.
What is blood? The composition of blood type group, health, blood, introduction to blood donation and transfusion, impact of blood donation, criterion of blood donor, method of blood donation, storage management, issues and challenges of blood donation, data analysis of blood donor from 2000 to 2004, discussion and conclusion, and lastly, reference.
Acknowledgement.
I would like to express my sincere gratitude to our teacher for her guidance and support throughout this project. I also thank my group members for their cooperation and dedication in completing this work. Finally, I am grateful to the resources and organizations for providing valuable information that made this project possible.
Objectives.
This project-based learning is to investigate and learn about the human blood-related content. Students will learn and acknowledge about the composition of blood, blood groups, blood health, impacts of blood donation, and its criterion. Along with blood donation methods and the issues and challenges related to blood donation.
1. What is blood?
Blood is a vital, life-sustaining fluid that circulates through the cardiovascular system, keeping us alive. It acts as the body's primary transportation network, which delivers the essential substance such as oxygen and nutrients to the cells and carries away the metabolic waste products. Without blood, the body's organs and tissues would not be able to function properly.
2. Composition of blood. Overview of blood composition.
Blood can be seen as a mixture of a liquid base and solid tools. It has been divided into two categories, which is the plasma liquid and the form elements. 55% of our total blood volume is made out of plasma. It is roughly 90 to 92% water, which allows it to act as a solvent for transporting materials. Plasma included proteins, electrolysis, nutrients, and waste products. The remaining 45% was made up from the form elements, which are distinct biological structures. It contains red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes.
Plasma.
Plasma is the liquid component of blood that holds the blood cells in suspension. It makes up 55% of our total blood volume. Table distribution of plasma components. Components. Water. Percentage contained 90 to 92%. Key details. Acts as a solvent for transporting materials. Components. Protein. Albumin, protein globulin, protein fibrinogen. Percentage contained 7 to 8%. Key details. Maintains osmotic pressure. Keep fluids from leaking out of vessels. Include antibodies to fight infections. And essential for blood clotting. Components. Dissolved sustains. Percentage contained 1 to 2%. Key details. Nutrients such as glucose. Waste products such as urea. Mineral salts such as electrolytes.
Key function of plasma.
Transport carbohydrate food, which is nutrient from the ileum to the liver and body cell. Waste removal pick up carbon dioxide and urea to be extracted by the lung and kidney. Hormone delivery move hormone from gland to target organ. Heat distribution helps distribute heat throughout the body to maintain a constant temperature of 37 degrees Celsius.
Red blood cells. Red blood cells, RBC, is also known as erythrocytes. It looks like a tiny, flexible donut shape without a hole, which are called biconcave discs that provide a huge surface area to carry oxygen and allows themselves to squeeze into tiny capillaries. The main purpose of RBC is the delivery function. It delivers the oxygen inhaled from lungs to each cells in our body and bring the carbon dioxide back to our lungs for exhalation. The RBC also acts as the BPF buffering tools that prevents our blood to be too acidic. It's also the controller of blood flow. This allows more blood and oxygen to flow through a specific area when needed. The RBC also has a lifespan of 120 days and will be replaced by the new ones that are produced by bone marrow. Red in red blood cells comes from the hemoglobin, a complex protein that contains iron. It grabs oxygen from lungs and lets it go to organs and muscles.
White blood cell.
White blood cells, also known as leukocytes, they contain 5 main types which can be categorized into the first responder group and the special op group. Granulocytes, the first responder, neutrophils, the most common WBC, infantry that rush to the site of an infection to swallow and digest material. Eosinophils is specialized in attacking parasites and heavily involved in allergic reaction. Basophils is the reverse type. It believes histamine which triggers inflammation to help other immune cells to the crime scene. A granulocyte is the special op. Lymphocyte is the base of the operation. B cells produce antibodies and the T cells hunt down infected or cancerous cells. Monocyte is the largest WBC, turned into macrophage which clean up the cell and the beast.
White blood cell.
The key function of WBC, which is white blood cell, is to search and destroy it. It operates through several mechanisms. The function of phagocytosis is many WBCs like neutrophils and macrophages basically conquer and remove invading pathogens. Antibody production is lymphocytes produce antibody to neutralize virus before it may use it. Lipids can flatten themselves and crawl through the walls of capillaries to reach an infection in the skin or organ. Chemical warfare is release cytokine, a signal to call for backup and toxic enzymes to dissolve the cell walls of bacteria.
Platelets.
Platelets, also known as thrombocytes. It is the smallest component of the blood and originally is the broken off pieces of giant cells called megakaryocytes found in bone marrow. Platelets levels must be constant and remain balanced. This is because if it is too low, it will lead to thrombocytopenia, which is unavailability of blood clotting, leading to easy bruising and prolonged bleeding. While if the platelets level is too high, it will lead to thrombocytosis, which the blood may clot too easily, letting it to form clots inside healthy blood vessels, causing heart attacks or strokes.
Platelets. The clotting process.
Clotting process, the protocols. Adhesion, the signal. When a blood vessel is damaged, the underlying fibers are exposed. Platelets will be attracted to the underlying fibers. When a blood vessel is damaged, the lens sticks to the site of the break immediately. Activation and aggregation. The plug. Once stuck, platelets change shape and release chemical signals to call for backup. Other platelets runs to the scene and pile on top of each other, forming a temporary platelet plug. Coagulation. The reinforcement. Platelets work with proteins to create fibrin. Fibrin act like a microscopic net that waves through the platelet plug, trapping RBCs and turning the soft plug into a tough, durable clot.
3. Blood type groups. The ABO blood type.
The ABO system clarifies blood based on the presence or absence of specific proteins called antigens on the surface of red blood cells. Blood group A has A antigens on the cells and anti-B antibodies in the plasma. Blood group B has B antigens on the cell and anti-A antibodies in the plasma. Blood group AB has both A and B antigens on the cells and no antibodies in the plasma. Blood group O has no antigens on the cell and both anti-A and anti-B antibodies in the plasma.
4. Health of blood. Rhesus, RH factors.
The RH factor is a specific protein, the antigen, that determines if our blood type is positive or negative. RH positive contains RH protein on your red blood cells. This is the most common type. Approximately 85% of people have that. RH negative means that they do not have RH protein. The RH negative individuals can develop antibodies against RH positive blood if they are exposed to it. For example, during pregnancy or a mismatched transfusion.
Facts of transfusion.
When a patient receives the wrong blood type, the immune system launches a massive attack. Agglutination. The recipient's antibody latch onto the foreign red blood cells, causing them to clump together. Hemolysis. The clump cells burst, releasing hemoglobin into the bloodstream, which can lead to kidney failure and shock. Safety check. This is why cross-matching, mixing a donor and recipient's sample in a lab first, is mandatory before any transfusion.
Common blood disorders.
Anemia, the most common, caused by lack of healthy red blood cells or hemoglobin due to iron deficiency. The impact includes lower oxygen transport that leads to extreme tiredness, pale skin, and shortness of breath. Leukemia, a type of cancer where the body produces an abnormal amount of white blood cells. Hemophilia, a genetic disorder where the blood does not clot properly.
Blood pressure health.
Pressure health is the pressure of circulating blood against the wall of blood vessel. The two numbers, systolic top number, the pressure in your arteries when your heart beats, which is contract. Diastolic is the bottom number, the pressure in your arteries when your heart rest between beats. The number range is usually around 120 to 80 mmHg. The issue is hypertension is put strain on the heart and can lead to hypotension, can cause dizziness or fainting.
5. Introduction to blood donation and transfusion. Blood donation and transfusion.
Blood donation done by healthy individuals can be voluntary or replacement. Types: whole blood donation, component donation, platelets and plasma. Benefits: save lives, helps maintain blood bank supply. Blood transfusion given to patients uses whole blood or components. Common indications: severe anemia, trauma and surgery, cancer and chemotherapy, bleeding disorders. Requires compatibility testing, close monitoring for reactions.
6. Impact of blood donation. Importance of donating blood.
Blood is needed for surgery and blood transfusion, for victims of the accidents and treating diseases such as leukemia. Blood donation is the process of voluntarily giving blood to help save the life of others. Donated blood is used in hospitals for patients who need transfusions due to accidents, surgery, childbirth complications, or medical conditions such as anemia and cancer. Blood donation is a simple act that can make a significant difference in saving lives.
Importance of donating blood.
Blood donation involves collecting blood from a healthy individual and storing it for medical use. There are several types of blood donation. First, whole blood donation. Whole blood donation is the most common type of donation, where blood is collected and later separated into red blood cells, plasma, and platelets. Second, platelet donation. Platelet donation only collected the platelet and the remaining blood components are returned to the donor's body. Platelets are important for patients with bleeding disorders or cancer. Third, plasma donation. Plasma is donated to help patients with burns, shock, and clotting disorders.
7. Criterion of blood donor. Criterion of blood donor.
Blood donor criterion refers to the set of rules used to determine which blood type can safely donate to or receive from others. There are a total of 8 types of blood: O minus, negative O, positive O, negative A, positive B, negative B, positive A, negative AB, and positive AB, which is important to know the criterion. It is important to know the criterion to ensure safe blood transfusions, preventing reactions that could be harmful or life-threatening. To be eligible for blood donation, a minimum weight of 50 kilograms must be met, and an age between 17 and 65 years old is generally required. Good health must be maintained on the day of donation. Vital signs such as hemoglobin levels and blood pressure are screened by medical staff before the procedure is approved, as well as a temporary deferral may be issued if tattoos, piercings, or travel to malaria endemic regions have occurred within the last few months. Finally, it is recommended that an iron-rich meal must be consumed and plenty of water be drank prior to the appointment to ensure donor safety.
Table of blood donor criterion.
The only blood type that can be donated to anyone is blood type O negative, while the only blood type that can be received from any donor is blood type AB positive, and the red blood type has specific blood type to match.
8. Methods of blood donation storage management. Methods of blood donation storage management.
Inventory and safety management. Blood banks also use FIFO system, first in, first out. Temperature monitoring alarms. Cold chain maintenance during transport. Leukocyte reduction, removal of white cells. Irradiation for immunocompromised patients. Special storage techniques. Frozen REOs. Store at negative 65 degrees Celsius. Shelf life up to 10 years. Rare blood types. Pentagon inactivation systems. Plasma and platelets.
Methods of blood donation storage management.
Storage method by blood component. Red blood cells, RBCs, temperature 1 to 6 degrees Celsius, refrigerated. Storage solution, anticoagulants, preservatives, CPDA-1, SAGM. Shelf life, 25 days, CPDA-1. Up to 42 days with additive solution. Purpose, treat anemia, blood loss, surgery patients. Platelets, temperature 20 to 24 degrees Celsius. Storage condition, continuous gentle agitation. Shelf life 5 to 7 days. Special concern, high risk of bacterial growth. Purpose, cancer patient, bleeding disorders. Plasma, fresh frozen plasma, FFP. Temperature, less than or equal to negative 18 degrees Celsius, often negative 30 degrees Celsius. Shelf life, 1 year, negative 18 degrees Celsius, up to 7 years, negative 65 degrees Celsius. After thawing, use within 24 hours. Refrigerated. Purpose, clotting factor, deficiencies, massive transfusion.
9. Issues and challenges of blood donation. Issues and challenges of blood donation.
Number 1. The perishability problem. Red blood cells only last up to 42 days. Platelets' lifespan is just 5 to 7 days. This creates a just-in-time supply chain where even in a single week of low turnout can lead to a critical shortage in hospitals. Number 2. Demographic and lifestyle shifts. In many regions, the population is graying. Older individuals are the primary consumers of blood for surgeries and cancer treatments, while the younger generation, the primary donor pool, is donating at lower rates than previous decades. Historically, many donors occurred at workplace blood drives. With the rise of hybrid and remote work, these convenience opportunities have vanished, making it harder to recruit busy professionals. Number 3. Safety and screening deferrals. To protect the blood supply, screening is especially strict. However, this leads to high deferral rates. Iron deficiency, low hemoglobin is the reason donors are turned away. Travel and health history. Strict rules regarding recent travels to malaria zones, tattoos, or certain medications disqualify a significant portion of willing volunteers.
Issues and challenges of blood donation.
Number 4. Physical side effects. Mild reactions occur in about 50% of cases, including fatigue, dizziness, nausea, sweating, and bruising at the needle site. Severe reactions such as fainting, vomiting, and convulsions are rare but possible, particularly for new or low-weight donors. In conclusion, blood donation issues involve physical side effects like dizziness and fatigue, fear of needles, and misconceptions about the process, alongside logistics such as long, time-consuming visits. Common barriers also include donor anxiety, health concerns, and strict eligibility criteria, while rare risks include iron deficiency, citrate toxicity in plasma and platelets, and fainting.
10. Data analysis of blood donor from 2000 to 2014. Data analysis of blood donor from 2000 to 2014.
Blood procurement in Malaysia is centered on a relatively non-remunerated floor. On this basis, total number of blood donation from mobile site, blood collection centers and hospitals increased by 86.7% from 361,898 to 675,315 cases between 2000 to year 2014. Total number of blood transfusion increased by 123.5% from 151,504 to 338,598 times during the same period. By type of donor, greater growth is seen among repeat donors, which is 37.1%, compared to new donors, which is 13.3% between the year 2008 and year 2014.
11. Discussion and conclusion. Discussion and conclusion.
Blood donation plays a critical role in healthcare system worldwide. One donation can help save up 3 lives because the blood can separate it into different components. Hospitals rely on regular blood donations to maintain a stable supply, especially during emergency and disasters. In addition to helping others, blood donation also benefits donors. Donors often receive basic health checks such as blood pressure and hemoglobin screening. Blood donation can also promote awareness of personal health and encourage a sense of social responsibility. However, blood donation rates can be affected by fear, lack of awareness, or misinformation. Education and community campaigns are important to encourage more people to donate blood regularly. In conclusion, blood donation is a safe and meaningful act that saves lives and supports medical treatments. By donating blood regularly, healthy individuals can contribute to the well-being of society.
12. References.
So these are the reference. First, World Health Organization, WHO. Second, Ministry of Health Malaysia. Third, National Blood Center. Fourth, International Society of Blood Transfusions. Fifth is our school CHKL Chonghua Kuala Lumpur Science textbook.
6. American Red Cross Biomedical Services. 7. Medline Plus U.S. National Library of Medicine. 8. Cleveland Clinic. 9. Stanford Medicine.
Special thanks to my teacher and my teammates.